And of course, we're not done until we've documented. Document always. And there's forms and forms and forms for documenting. Some of the things that need to be included is the date, the patient's name, the vaccine lot number, and a lot of the vaccinations now, unit dose, although in the clinics I'm thinking not so much so, probably going to be a multi-dose vial, but each and every bottle has on it the name of the manufacturer, the lot number, the expiration date. That information needs to go on each and every vaccine administration record sheet. Who administered it, what site you administered it to, and information on those refusing the vaccine. That's what it says on the slide here. I'm thinking if they're refusing the vaccine, they're not sitting at your table. They're not even there. Here's a form. This, to me, when I looked at this form, is a form that would be more particular to a doctor's office. I've done lots of vaccine clinics, and this is not what I see people present with. There's a different form for the individual vaccines, but if you look at this, this is the patient's name at the top, the patient's date of birth, the chart number, and this says what vaccines they've gotten on what date. You may have something like this presented to you, or a card presented to you by the patient that you're going to fill in. But there will be some form of a vaccination administration record that is standardized, that will be particular to your clinic, that will need to be filled out. We'll have all that information that I just talked to. It just might not look like this. But if it does, here's a filled out one. And again, these forms are available from the CDC on their website. You should become familiar with it, look at it. But again, if you look closely, this says that the person got MMR and what the date was and all of that information that needs to be filled out. Skills checklist. Okay, this is very important for you, the paramedic. This is part of your prerequisite packet. This is part of what is going to continue to allow you to be part of the vaccine clinics. It has things like, how did you greet the patient? Did you use the proper technique? Et cetera, et cetera. This does need to be filled out, and at the end of the clinic, filled out by someone in charge of the clinic, and given to you to be turned in to the Bureau of EMS. Honestly and truly, if the clinic is busy, you're not going to have someone standing there watching your every move. But there should be people drifting through, verifying the fact that you are performing to the standard that we expect you to perform. Now, if we're in a healthcare crisis, a pandemic or an epidemic has been declared, and your all health hazard region has stood up a clinic, this may not happen because it's going to be all systems go. And people are going to be more concerned about the first time they've stood up their clinic. Make sure that you talk to the Bureau, let the Bureau know, and try to get this done. If you're going to be involved in a clinic that is preset, local with the VNA, et cetera, you should be having conversation with them ahead of time that says this skills checklist needs to be done for you. Pediatric immunizations, why they felt they needed a separate one, the CDC, I don't know. But there's an adult one and a child one. All right, look at that. We're almost done. Here's the summary, the thing we talked about. We looked at the historical perspective. Wasn't that fun? We looked at distribution and transmission. We looked at what's the difference between epidemic and pandemic. We talked about how we protect ourselves, good hand hygiene, mask, cough, decontamination. We talked about those poor little chicken eggs that had no choice but to become part of our process, and administering vaccines, policies, procedures, documents. We talked about all the federal documents that you should become familiar with that are part of federal law when it comes to doing immunization clinics. Just remind you, there's only 2 immunizations, 2 vaccines that you're going to be administering. That's the flu, either the injected or the nasal, and the pneumococcal pneumonia. Questions? All right, I'm sure you're thinking, okay, what next? How do I get involved? Who do I talk to? Here's some ideas. I said your local VNA. VNAs do a lot of flu vaccine clinics. Find out in your area. Is there a neighborhood health center that you have that is going to do a flu vaccine clinic. They like to have people helping. Schools. The other targeted population, beside healthcare workers and the elderly, is going to be school-age children this time around. It's going to be the big push. Senior centers, they love doing this kind of stuff. Find out from the senior center, do they have somebody coming? Residential care facilities, do you have a nursing home, an assisted living in your area that they're going to be doing this? Industry, occupational health, is it a big company that's going to run a clinic? Find out about this. Regional national pharmacies, Rite Aid, Walgreens, Walmart, they do flu clinics. I've seen them advertised, so find out. In your area, who's the all health hazard regional coordinator? Because if they stand up a clinic, they're going to be looking to EMS to be helping. You can bet you're going to be asked. Or maybe you're going to be the one to organize something in your area. Maybe your EMS district or region, you'd like to put together a clinic to help immunize your fellow EMS units. Here's what you need to do, because it is a prerequisite protocol. Your EMS unit needs to be involved. Even if you are the sole paramedic in your EMS unit that's gone through this training, your EMS unit needs to complete the packet that says, we support this, that there is a medical direction approval, there's letters of, or at least a letter of recommendation, that you are competent in giving IM injections, et cetera, et cetera. Quality management program. All these things are part of the packet. That packet is available through Vicki Blanchard, our ALS coordinator for the Bureau of EMS. I want to thank everyone for taking the time. I know this seemed like a long program. Thank you for your interest. I think this is great and exciting. I think it's something that, as paramedicine is developing, is just a wonderful opportunity for everyone. Any further questions? Department of Safety, Division of Fire Standard Training and EMS, your ALS coordinator, extraordinaire. I want to thank everyone for coming. Here is a bunch of resources. I'm hoping that on your Noodle site, you can download this, print this, link, go to these links. Those of you, there are lots of curious minds out there who like to read a lot more background information than what I've presented to you. There's your opportunity. And that's all I have for today.